The issue that I'd like to talk about today has a lot of rampant misinformation surrounding it, as well as being an issue that not only conservatives seem to raise, but a lot of people who I would typically not see expressing homophobia or transphobia. This issue is that of children having access to transition healthcare. As a trans person myself, I didn't start my transition until I was 19 years old. The majority of trans individuals also transition as adults, but in recent years we have seen more and more movement by the medical community to address gender dysphoria in children. Most of the contention surrounding this issue is the idea that kids can't possibly know what their gender is at such a young age. They'll change their mind and regret that decision later in life. However, if you were to ask a transgender person the first time they thought they experienced gender dysphoria, a majority would tell you very early in life, usually between the ages of 4 and 9 years old. Many children do have fluid gender identity and gender expression, but I can think of many friends I had growing up who knew exactly what their gender was from an early age. This fear of a child changing their mind also doesn't take into consideration the lengthy process a transgender child must go through in order to transition. I'd like to lay out how that would all go about. Let's say around the age of 3 or 4, your son starts expressing that he wants to be a girl. You tell him it's okay to be a boy who wears dresses and plays with girl things, but he is adamant. He is not a boy. So, after deliberating, you decide to go through the transition process. At this young age, your now daughter begins to grow her hair out. She picks out a new name and starts wearing clothing from the girl section. She makes a full social transition before she even starts kindergarten. You set up appointments to have your daughter looked at by multiple doctors and psychiatrists. They all say she has gender dysphoria and that transitioning is the right choice. The infamous puberty blockers would not be considered until your daughter hits Tanner stage 2 of puberty, which usually occurs around the age of 11 or 12. By that point, you have had numerous appointments with multiple health professionals, and your daughter has been living as a girl for 7 to 8 years. Even then, doctors are careful because there are quite a few children who experience gender dysphoria as children that dissipates once they reach puberty. However, if your daughter hits this stage in her life and still experiences gender dysphoria, it is at this point that these feelings have been found to rarely disappear. By utilizing puberty blockers, you are not making any major changes to the child's body. You are not introducing new hormones from the opposite gender. You are merely pressing pause on your daughter's progression into that of a pubescent boy. This suppression doesn't cause any irreversible or harmful changes in physical development, and puberty can be resumed right away if the puberty blockers are stopped. If your daughter does truly have gender dysphoria, the onset of male puberty is highly associated with worsening of said gender dysphoria, distress, and destructive behavior. Dr. Jack Turbin, a resident psychiatrist at the Harvard Medical School, surveyed 20,000 transgender individuals and found that 90% of trans adults who wanted but could not access puberty blockers experienced suicidal thoughts. For transgender adults who had been able to access puberty blockers, it was 75%. Now, granted, both of these numbers are staggeringly high, but there are many important factors that play into lowering the suicide rate of transgender individuals, access to transition healthcare being an important one. For children who start puberty blockers and change their mind, this stop the clock can easily be unpaused and normal puberty resumed. The rate at which children start puberty blockers and go off them varies depending on the diagnostic procedures of the clinicians treating these patients. But a study done in Amsterdam, surveying 6,793 patients, found that only 1.9% chose to go off puberty blockers. The diagnostic evaluations clinicians use are incredibly stringent and comprehensive. A child is tested on the degree of gender dysphoria, coexisting psychiatric conditions, and psychological stability, usually going through 10 or more tests covering everything from the autism spectrum to depression and anxiety. In order for transgender children to have access to any hormones, they have to meet much more criteria than their adult counterparts seeking the same care. In order for my 20-year-old self to access testosterone, I only had to go through 2 appointments. One discussing all of the risks and effects of testosterone, and one a psychiatric check for gender dysphoria and no other major psychological issues. Several treatment teams looking at youth who went off puberty blockers found that they didn't interfere with the development of gender identity. Puberty blockers have been used for years on children who hit puberty too early, and there has never been any indication that this leads to a transgender identity. Even with medical professionals erring on the side of caution and rarely having children go off of them to start normal puberty, the risks are minimal when it comes to puberty blockers for transgender patients. A child who has also been on puberty blockers and then goes on to start hormone replacement therapy also faces less risk and has an easier transition than if they had been allowed to manifest their birth sex characteristics before starting hormones. The only concern that some medical professionals have discovered is that hormones like testosterone and estrogen do play a role in the accumulation of calcium on the bones and can have some effect on fertility. So far, these negative effects have not been shown to be substantial in a child's physical well-being, although more research is needed to know the effects 20 to 30 years down the line. That being said, medical professionals across the country find the short-term effects of lower suicidality, stress, anxiety, and depression far outweigh this potential risk. A dead child is a much bigger problem than a slightly unhealthier one. The age at which your transgender daughter would first start using hormones that would forever change her body, that being the use of estrogen and a testosterone blocker, would not occur until she reaches the age of 16. By this point, your daughter has been living as a girl for 12 to 13 years. She has been through countless doctor's appointments and psychiatric check-ins to make sure this is the right decision for her. She is not going to change her mind. This is not a phase. Transgender children are a real and important phenomenon. The same Amsterdam study mentioned earlier that surveyed 6,793 transgender patients found that not a single one chose to stop gender-affirming hormone therapy. Some trans men will go through a top surgery operation around this same age, but the more invasive bottom surgery is always saved for adulthood. Top surgery is often done before the age of 18 because the safety and flexible schedule that is allotted by still being in school and living with family means the recovery process will be much easier than if the surgery had been done later in life, when our schedules tend to be flooded with 40-plus hour work weeks that don't usually allot much time off. Never mind the financial situation required to afford an expensive surgery and 2 weeks away from work to recover. Medical professionals agree that the only solution to gender dysphoria is to transition, and with more and more visibility available on the transgender community, it can seem like there has been an explosion of rapid onset gender dysphoria. This is not the case. We are just living in a world where for the first time in modern Western history, transgender people can live out their true lives rather than shutting themselves off. Young transgender children who have parental support and are allowed to go through with a social transition starting early in life have been shown by a number of different studies to have rates of depression and anxiety similar to that of their cisgender peers as they grow older. If you take a look at websites like the Trevor Project, this trend isn't the case for all transgender youth. Feelings of depression and suicidality still run rampant among the community, as well as a much higher rate of sexual violence and physical threat or injury. Legislation like that in South Dakota, which attempted to block access to puberty blockers and surgery for children under the age of 16, is being considered across the country by conservative politicians who have bought into the lies being spread about this subject. Websites like SEGM, the Society for Evidence-Based Gender Medicine, are full of misinformation cleverly disguised to look legitimate. Their website first claims that child-onset gender dysphoria has been shown to have a high rate of natural resolution, without further explaining that by the time puberty has hit, childhood-onset gender dysphoria has now progressed into regular gender dysphoria that will not resolve itself. The website then says that children don't receive an adequate psychological assessment before being put on hormonal treatment, that they receive full sex change surgery, and that multiple studies have found bone and skeletal impairments, cardiovascular complications, premature death, and high rates of post-surgery suicide, without citing any studies to back up these claims or explaining further. The website then claims that all current medical protocols surrounding transition healthcare for children is based off of a 55-person Dutch study, which is sorely inaccurate. On the About Us page, you can find a list of 15 doctors representative of nearly 100 clinicians and researchers concerned about the lack of quality evidence for the use of hormonal and surgical interventions as first-line treatment for young people with gender dysphoria. The first doctor listed treats diabetes and metabolic disorders with absolutely no experience in treating gender dysphoria. The next is a pediatrician who has expressed concern online at the hundreds, perhaps thousands of detransitioners, and tries to cite anecdotes of her patients' experience with the local gender clinic as evidence, despite none of them seeming to be unhappy with the experience or detransitioning themselves. The list goes on like this, doctor after psychiatrist after psychotherapist, without any experience as a professional who actually treats gender dysphoria. Not a single transgender person is represented either, which you would think would be something important to transgender individuals if children were actually being treated with as much mishandling as is claimed all through this website. Right now, we live in a world where the average age a child realizes that they are transgender is 8 years old, but the average age they come out to their family is 17. 35% of these youth have clinical depression, with rates of suicidal thoughts and attempts being much higher. It is paramount that the medical community and parents with a transgender child are working to make timely interventions to address this problem so it doesn't get out of hand. If it has already been shown that an early acceptance and helping hand in transitioning can plummet rates of suicide, depression, and anxiety, why aren't we doing more to make sure that those 8-year-olds don't feel like they have to hide who they truly are? I would highly suggest you go watch this video from them, telling the story of a young girl going through the same process I described in this video and her own mother's journey to love and accept her own daughter. Thank you for watching.